Ebola, like Marburg virus disease, Lassa Fever and yellow fever, belongs to the family of hemorrhagic fevers. It is a serious disease that mainly affects Central and West Africa. Ebola disease, often just called Ebola, is a rare illness in humans. There are different types of Ebola that vary in severity, but the disease is often fatal. The virus is transmitted by direct contact with bodily fluids such as blood, saliva, sweat, tears, mucus, vomit, feces, breast milk, urine, and sperm of people or animals which have been infected or have died from the disease. It is also transmitted by touching objects contaminated by these fluids. The symptoms of Ebola disease can be sudden and often include fever, fatigue, muscle pain, headache, and sore throat. These are followed by vomiting, diarrhea, rash, and internal and external bleeding. It generally takes between 2 and 21 days from the time a person is infected to the time they show symptoms. People can transmit the virus as long as their body contains the virus, even after they have died. When living in or traveling to a region where Ebola viruses are potentially present, avoid contact with people or animals who are sick. Avoid contact with corpses and/or the bodily fluids from deceased patients or animals. Avoid contact with items that may have come in contact with an infected person or animal's bodily fluids. Avoid contact with wild animals or raw meats of these animals. ECDC monitors and tracks outbreaks of Ebola disease that may have an impact on public health in Europe and works closely with international health organizations to keep abreast of epidemics. It also provides advice and technical assistance to European countries on assessing and responding to Ebola disease cases. This includes recommendations on surveillance, diagnosis, and prevention and control measures.